Good morning. Let us have a short discussion about the management of a cyst. Always the management of cyst will follows either we have to do a marsupialization, enucleation, or a resection. First, we'll see in detail about the enucleation. Enucleation, which is nothing but the shelling out of the entire cystic lesion without rupture. It means that we have to remove the entire cyst along with this epithelial lining. So when the enucleation is indicated, it's most commonly indicated when the size of the cyst is less than 2 centimeter. And then the recurrent cyst of any type can be enucleated. So it's a pictorial representation of enucleation where you can able to appreciate that the entire cyst has to be removed along with this epithelial lining. So there are certain modification of enucleation. First one, you can either enucleate the cyst and close the cyst as it is, which is called enucleation and the primary closure. Or else enucleation and a packing can be done, or enucleation and the curettage, enucleation and the peripheral osteotomy, enucleation with grafting, and enucleation with the cauterization. Enucleation with packing. After enucleating the cyst, you can pack the cavity with a iodoform or a whitehead varnish. So I'll tell you the composition of whitehead varnish. It consists of iodoform 10 gram, benzoic acid 10 gram, storax 7.5 gram, balsam of tolu 5 gram, ether 100 ml. So this is a composition of the whitehead varnish, where after enucleating the cyst, you have to pack the cavity with this whitehead varnish. And another modification is that either you can do enucleation and the curettage. After enucleating the cyst, you have to curate the socket where the cyst has been located. Or else enucleation with the peripheral osteotomy. Peripheral, it indicates that the surrounding. Peri is a surrounding. So after enucleating the cyst, you have to remove 1 to 2 mm of the bone which is present beyond the visible margin of the lesion. So after enucleating, remove 1 to 2 mm of the bone beyond the visible margin of the lesion. Or else you can do enucleation with grafting, or else enucleation with chemical cauterization using Cornoy solution, which is the most commonly used solution. So one has to know the composition of Cornoy solution. It includes chloroform 3 ml, glacial acetic acid 1 ml, perchlorate 1 gram, alcohol 6 ml. Whereas the recently modified Cornoy solution is one which does not include chloroform due to its carcinogenic agents. So that the modified Cornoy solution constitutes of glacial acetic acid, perchlorate, and the alcohol. Or else you can either do an enucleation and a liquid nitrogen therapy. It's nothing but after enucleating the cyst, you have to treat the socket with a liquid nitrogen for at least for 1 minute. Twice you have to do, so that you have to do for 2 minutes. So but in between the first cycle and the second cycle, you have to leave at least 5 minutes gap. So first 1 minute you have to apply the liquid nitrogen, wait for 5 minutes, and the next 1 minute you have to apply the liquid nitrogen. So twice you have to apply for 1 minute. Whereas in case of cauterization using chemically Cornoy solution, you have to apply the solution for 5 minutes. So after application of 5 minutes, the depth of penetration of Cornoy solution will be 1.54 mm. So remember this, you have to apply the Cornoy solution for 5 minutes. So the depth of penetration of Cornoy solution will be 1.54 mm. So coming into the marsupialization. So there are two techniques, which is called Pash 1 technique and the Pash 2 technique. Pash 1, just nothing but either you have to do a decompression or marsupialization. So it's called a cystotomy. Whereas a Pash 2, it's called as a Waldron's technique, which includes cystectomy. It means after doing a marsupialization, you have to wait for a few days and you have to remove the entire cyst along with the lining. It means marsupialization followed by enucleation. Whereas Pash 1 is the decompression or the marsupialization. So what is this difference between the decompression and the marsupialization? So decompression, so the name itself indicates that something you are going to do, decompress the cyst. So decompression is just nothing but you're just going to create a window in the area that are not impair function. So by creating the window, you will allow the pressure which is present inside the cavity to get reduced. So by the way, the content which is present in the cystic cavity will get drained. Whereas in case of the marsupialization, it's nothing but the entire roof of the cyst has to be removed. So de-roofing of the cyst. So followed by suture that cystic wall to the surrounding normal mucosa. Allow the content to drain for a few minutes. So allow the content to drain completely. So completely. After a few days, the size of the cyst will get shrink off, and then we have to remove the entire cystic cavity cyst with the lining. That is called as Waldron's technique. So the difference between the decompression and the marsupialization is that decompression is window is created, whereas marsupialization is entire roof of the cyst is removed. So this is a pictorial representation of the marsupializations where the entire roof of the cyst is removed and the remaining cyst is sutured to the normal mucosa. So this is a chart which shows the Waldron's technique. First, we have to marsupialize the cyst, pack the defect with iodoform gauze, and later the cyst allow the cyst to reduce in size. Once the cyst becomes smaller in size, enucleation has to be carried out. So these are all the conservative management of the cyst. Either you can do an enucleation or you can do a marsupialization. So as I told, when to do an enucleation? Only in case the size of cyst is smaller than 2 centimeters. When to do a marsupialization? Marsupialization is most commonly indicated whenever the cyst is associated with the vital structures. For example, if the cyst is associated with an infraalveolar nerve, so in order to preserve the nerve, to prevent the damage to the nerve, we can do a marsupialization to prevent the damage to the nerve. Similarly, if the cyst is associated with the tooth has to be erupted. So in order to prevent the removal of the tooth, we can do a marsupialization rather than doing with the enucleation. So coming into the surgical procedures, at last one is the resection. Resection, it means that we are going to resect the part where the cyst is located. So when we have to do a resection is always indicated whenever the cyst is larger in size and it's aggressive in nature and it causes the perforation of the surrounding bone and started to cause perforating or resorption of the bones, which is where it is located. So in case of mandible, we have to do marginal en bloc resection or segmental resection. In case of maxilla, we can do partial, subtotal, and the total maxillectomy. I'll show the pictorial representation of each. So it's a marginal resection and segmental mandibulectomy of mandible, where you can appreciate that in marginal resection, the lower border of the mandible can be preserved. Whereas in case of segmental mandibulectomy, we have to remove the segment where the cyst is located along with its lower border. So it's not possible to preserve the lower border in case of segmentum, whereas it is possible to preserve the lower border in case of marginal resection. Coming into the surgical procedures which involving the maxilla. So maxillary procedures which includes medial maxillectomy, infrastructure, suprastructure, subtotal, and the total. What is this medial maxillectomy? Medial maxillectomy. The part of the maxilla next to the nose is removed, but the eye and the hard palate is preserved. Whereas in case of infrastructure of maxillectomy, where we are going to remove the lower part of the maxilla along with the hard palate. In suprastructure, upper part of the maxilla and the floor of the orbit will be removed. Whereas in case of a subtotal maxillectomy, where we have removed any maxilla resect involving at least 2 walls of the maxilla has to be removed. It includes the floor of the antrum with exception of the posterior wall. Whereas the total maxillectomy, it includes the half of the total maxilla has to be removed. So coming into the summary, always the cystic management which follows marsupialization, enucleation, and the resection. Part 1 and the part 2. Part 1 is decompression or marsupialization. Part 2 is called as a cystectomy, Waldron's technique, where marsupialize the cyst, allow the cyst to reduce size, and enucleate the cyst at last. Indicated in mostly in case of younger individuals. Enucleation mostly is indicated in the cyst where the size is less than 2 centimeters. The two important point in enucleation is Cornell solution, composition of the Cornell solution, and the modification of the Cornell solution. Apply it for 5 minutes. Depth of penetration is 1.54 mm. Coming to the resection part, mandible, two type, marginal, segmental, maxilla, medial, infrastructure, suprastructure, subtotal, and the total maxillectomy. So thank you.